We have our patient. We
I'll
know
tag you.
it is going to be her right thigh, and we're going to do a mole removal in the middle. And the first thing we need to do is shave the area. Okay. In the office, you're going to see some disposable razors like this. You just slide off the little cap, safety cap, and then you shave. You don't have to prep it. You don't have to use any shaving cream or anything like that. It's usually a dry shave against the grain.
That's rude.
Sorry. Okay, so after you shave the area, you would have an antiseptic wash here, and you could also have a betadine scrubber depending on the wound or depending on how doctor's orders are to clean the area. Our doctor wants us to scrub the area and get it going with the betadine solution. So the first thing we're going to do is clean the area. We're going to get it wet, and then we're going to turn it to the scrub sign. And open wounds, they actually use these scrubbers to scrub open wounds. And we're going to clean in circular motions, and we're going to go out around the edges 3 to 6 inches around the wound or the mole or whatever you're working on. And you need to do a 5-minute scrub. Okay? Making sure that it's nice and clean and the borders are clean around it. So your 5 minutes is up. Now you have your little gauze already soaking in some antiseptic. Now we're just going to clean the area. Nice little wipes. However much gauze you need to use. Ignore this suture that's in the leg. That was another surgery. Nice and done and ready. We would have a few little dry ones. Now we would do our dry sweep. Being careful if it's an open wound, around the open wound. Remember, it's probably painful. If it's just a mole, just do a nice little sweep and get it prepared. Okay? From there, you can throw out your wash, your scrub, your gauze, and everything like that. I'm saving it for you guys because you're all going to individually take turns and wash.
And where would that stuff actually be? Like over here on another tray? Because she's laying on the bed, so.
I brought it and set it on the bed next to her.
Okay.
To get her wound ready.
Okay.
We have a sterile tray and we have a non-sterile tray too for after surgery, and then before surgery I just bring everything in and set it right next to him. You can. Okay?
So you dip the sponge in that wash and that's okay to do?
Yeah, I got it activated a little bit, added water to it. Okay, now we want to, this was under patient's leg, we want to have her lift her leg. Talk to her too prior, while we're doing it, let her know. Obviously, we're cleaning it. We're going to scrub it a little. If it is a wound, it might be a little uncomfortable, but we'll try to be as quick and make it as painless as possible. Have her go ahead and lift her leg. Pull out your old chuck, discard of that. Work your patient around by working through and having your patient kind of rotate your leg. Get a new dressing in there and get her prepared for surgery. Throw out your razor. Sterile gloves were on to clean, okay? But we need to get rid of the sterile gloves and put on another pair of sterile gloves.
Do we wash in between or just sanitize or anything?
You don't have to. You can sanitize or you can just get your sterile gloves right back on because you got rid of everything on the gloves that you discarded. No jewelry. Open your fenestrated drape. We have fenestrated and we have non-fenestrated. Our fenestrated is actually, there is a hole built into it. Non-fenestrated are the ones without the hole. Here's a hole that it's turned. Okay? These are sterile. When they're wrapped, they're sterile. Okay? We've been using them for procedures and stuff like that, but you can use them for a sterile procedure. So what you want to do is open it and slide it up over your patient. Working from the sides, walking around, and pulling. Never reaching over. You can reach over with your patient as long as you're not nudging your patient in their face or anything like that. And now we have our special spot that we're going to work with. Okay? Doctor comes in then. Doctor's not there for the cleaning. Okay? Doctor comes in. Either the doctor's going to numb the area himself or he was going to ask you to have already numbed it. So what we have is some lidocaine and epinephrine. Epinephrine is used for what?
Constricting the blood vessels.
Right. Okay. You need to probably pull for even about a mole removal. We're looking about 2 ml, 2 cc's for